everyone. Thank you for listening to this webinar today. We realized that we forgot to record it when we did it a couple of weeks ago, so we decided that we would redo some of the webinar because we had a lot of requests for people to listen to what we were talking about. Thank you for everybody joining us and listening to this at a later date. So today we as a team are going to be talking about a functional medicine approach to hormone health. Really, just for everybody's information, is that, you know, this webinar is not providing medical advice. You still need to make sure that you are listening to your body, you're speaking to your professionals, and that if you needed any support, we are here and we're happy to speak to you about anything that you're experiencing at this time. This is now not relevant, housekeeping slide, but it's there in our little slide there. So if you do have any questions though, please do feel free to email us or do book an appointment to speak to one of our team. We have free 10-minute calls which are available and be able to book from our website. So I might just make sure that underneath the YouTube, we can put a little link there if you wanted to book an appointment with us. So who are we? So we are Dr. Indra, Specialist Functional Medicine Practice, and my name is Dr. Indra. I started this practice about 5 years ago. It came out of my own health journey, and also after being part of the NHS for over 16, 17 years, I realized that there was a bit missing in the NHS, that there was a lot of things that I wasn't really able to do, and a lot of my patients weren't feeling a lot better. So I found this approach to chronic health, and once I learned about it, I realized that I needed to provide this kind of care to my patients. Since that time, I have now grown, and we are now working as a multidisciplinary team. So I'm going to introduce you to my team. So we have Dr. Ailsa Care.
Hi, I'm Dr. Ailsa. So I've been working with Dr. Indra's team for the last couple of years, and before that I worked for 3 years in an environmental medicine clinic. I came to this way of working like Indra through my own ill health, and it was root cause medicine that led to my recovery, and I just wanted to find out more about it so that I could help my patients. And it's left me with a thirst for knowledge and always wanting to learn and learn more.
Definitely, Elsa, you've got every book under the sun as far as I know. So then we have our other doctor, Dr. Meeta Tanner.
Hi, I came into functional medicine because, again, of my own frustrations of not being able to help my patients in 10-minute appointments as a GP, and I've always had an inquiring mind as to, you know, what is the cause of the symptoms that my patients come with, and I was never satisfied that we could get to the bottom of it, but more plaster symptoms over with drugs and treat symptoms with drugs rather than get to root cause. So for me, functional medicine has been a godsend in terms of career satisfaction. And I've worked with the team for just over a year now. Thank you.
Thanks, Meeta. And Fiona.
Hi everyone, I'm Fiona Beard. I've worked with Indra's practice for about 9 months now. I've always had an interest and been curious about why people are well. So I originally started my career training as a nurse, and I found plenty of reasons why people were sick. And yes, some of them did get better, but did they thrive? Maybe not. And then I fell into the pharmaceutical industry thinking that pills might make people better, but discovered that quite often we make people feel worse. And through, like my colleagues, a health issue made me think there's got to be another way of determining why I'm not well. Found functional medicine, and at a quite mature age, trained as a functional medicine health coach, and here I am.
Thank you so much, Fiona. So we have other members in our team. We have a wonderful nutritional therapist, Shakila, who there will be a little video a little bit later that she has done for us. And our other health coach, Roz, who's on holiday at the moment. So hopefully we'll get to record her little section a little bit later and add it as a little extra video to our YouTube channel. So as you can see, the practice got CQC registration in December 2019, and all our doctors are GMC registered and are able to prescribe medication as well as give advice on supplements as well. So what are we going to do today? Today I'm going to start by really kind of, first of all, explaining a little bit about our approach to health and this little diagram that I've created. So what is health? The WHO definition of health is that health is a state of complete physical, mental, and social well-being, and not merely an absence of disease or infirmity. So when we go to a doctor, conventional doctor, we basically look at all the biological reasons that we are having a symptom. So these are all the biological reasons that you can see in there. So if we have a heart problem, those kind of things, then we deal with that. But there's so much more to health rather than just the symptoms. So what we found is that health kind of divides itself into 4 areas. The biological issues. Now, the biological issues in functional medicine, we look at more from a function. That's why functional medicine. So is your body's ability to digest the food and take in the nutrients working effectively? Is your body's immune system working effectively? Is your body communicating with itself? So that is all the hormone systems that we're talking about. And is your body able to grow effectively, produce all the joints, and is able to hold itself and have a structural integrity? So that's the biological systems. Then in addition to that, we have our nutrition, the food, the hydration. We have our lifestyle issues. How do we move, how we sleep, and how we restore? And in amongst all of that is also our mindset, how we believe, what we believe about ourselves, the thoughts, the stresses, how we deal with all of that. So that is us. That is the heart of us. All of us have this. So we have this continuously going on in our body. What then happens is life happens. Life, as they say, is a contact sport. So we have some kind of threat, some kind of trauma, some kind of stress, infections, anything like that happens to our body. What the body does, it has this amazing ability to balance itself. So it might go out of balance for a little bit, give you some symptoms or dis-ease. So it's an absence of ease. It's another way of looking at disease. And then it brings itself back into balance. But sometimes this gets stuck. And why does this get stuck? Probably due to continued threats or an inability of the body to rebalance itself. And that is what we are doing in functional medicine, is that we're always looking to find out where the imbalance is, what can we do to rebalance it and bring it back into balance. So we have these 3 A's at the bottom of these that help the body get back into balance. So the first step is sort of accepting where you are, then acknowledging the imbalances, then taking one small step. So all together, it brings us back to this whole diagram. And we as a team, well, I as myself as a practitioner realized that I can't deal with all of this by myself. So our team, our doctors tend to look at the biological and the lifestyle aspects. Our nutritional therapist looks at the nutritional effects, and our health coaches help to support you to understand the lifestyle effects and your mindset. So together as a team, we're able to support you in all aspects relating to your health. So that is why we have our multidisciplinary team here at Dr. Indra. So that's functional medicine, and that is our approach. So what we're going to do now is we're going to talk a little bit about hormones. Hormones. One of the key things that I want everybody to realize about hormones, and which I completely did not realize when I was in conventional medicine, is that all our hormones are all together linked. And as you can see from this picture, there are so many different hormones. And we're always trying to look at which one is deficient, what is the hormone that's missing, and how do we replace that hormone? And that's pretty much what happens in the conventional setting. Now, hormones also have their own internal circadian rhythm. That's another thing that is also very key. And you'll find out why this is key as we move along and as we see about how we manage hormones. So our hormones, one of the basic things that it does is to deal with threats. It also does healing, growth, and reproduction. So if anything is out of balance, these are the things that will start to be affected. Now, the other thing that we have in functional medicine, or another key principle that we have in functional medicine, is that we have an innate capacity within our body to heal. Our body knows what it needs to do. We never have to look at a cut and go, oh, come on, body, heal. It needs to heal up. It does it. It has the innate capacity to do this. And our hormones are also doing this all the time. So if there is a hormone that's out of balance, really, it is an appropriate response for the body. It's not an unappropriate or inappropriate response. It is because it is trying very hard to rebalance another hormone somewhere along the way. So the main symptoms we tend to talk about when we're talking about hormones are things like fatigue, weight gain, dry skin, mood changes. And this doesn't only mean for men, it can be for both men and women. And everything is interconnected. So when we're thinking about that, one of the key areas in functional medicine that we are dealing with are things like thyroid abnormalities or sex hormone abnormalities, so menopausal type symptoms or low testosterone type symptoms. But what we have forgotten is that our adrenal glands are also part of this whole system. So when we see this slide, if we have somebody with a thyroid abnormality, we really need to be looking more upstream to see why, what else is going on, because the adrenals could be why the thyroid is not functioning effectively. Now, adrenal glands produce our stress hormones. These are our flight or fight hormones. So when we are under pressure, whether it is perceived or real pressure or stress from the outside, our glands release these hormones. Now, these are amazing hormones. They really allow us to run away from this saber-toothed tiger. So we can get rid of it, fight it, go and do whatever we need to do. The problem is, in our 21st century living, we are constantly under this stress. So all our hormones are persistently being released. And the persistent of being released comes from very, very simple things such as the next email you need to open. What is in my bank account? What's going to happen tomorrow? All of these worries also trigger the very same response. So what we find that stress is often a key part of managing hormones. And you can see here how that sort of all interlinks. When you're in increased stress, you produce a lot more sugar in your system because you're obviously wanting to run away from these saber-toothed tigers. When you produce the sugar, you produce more insulin. And as you become more stressed and more inflamed, you develop resistance to it. You then get weight gain related to it. Then that causes more stress. You can see that the whole thing is very interrelated. So from everything that I've just said there, stress is a key part in managing hormones, which we all forget. Now, the other thing about managing hormones is about understanding how it's produced in the body. What do we need for the hormones to be produced? So are we having an adequate diet of all the key nutrients for the hormones to actually function effectively? Is there something actually affecting how the hormones are being transported? Is there something trapping it if you've got enough protein? And is there something interacting with it? Then is there something affecting the effect of the hormone? So at the level of the receptor, is there something affecting it? And we can see from that slide that inflammation and chromium and loads of other nutrients will affect that. And then the fourth part is, are we clearing away hormones? So when we're thinking about hormones, number one, where is the stress? Because that is often the trigger that would cause the inappropriate responses for your hormones, or an appropriate response which will result in the symptoms. Then, have we got everything that we need to produce the hormones, transport the hormones, have an effect that it needs to, and are we clearing away the hormones? So that's a little bit of a summary of a general perspective of hormones. So now we are going to go to Ailsa, and Ailsa is going to help us work our way through a case history. We thought that that would be a good way for people to understand our approach to taking a history, how we deal with our hormonal cases, and then we as a team are going to discuss it. We're going to put together our plan of action for this patient.
Okay, so let me just bring that over there. So I'm going to present the case of a 49-year-old female called Amanda. So she runs her own business as an events organizer. Her reason to contact the practice was just for some help to manage her menopausal symptoms and to improve her poor sleep. So the first thing that we do in a consultation is that we take a full history, right from your family history through your birth and your whole medical history. So she was a full-term normal vaginal delivery and was breastfed. There was a family history of irritable bowel syndrome in her mother, anxiety and depression in her father, and stroke in her maternal grandmother. She suffered recurrent ear infections as a child, requiring several courses of antibiotics, and acne through her teens, which was treated with a prolonged course of antibiotics. By her mid-20s, she then developed irritable bowel syndrome herself, with alternating constipation and loose stools, bloating and flatulence. And she actually worked out for herself that eating bread made things worse. So she generally excluded bread, but hadn't completely cut out all gluten-containing products. She tried a couple of treatments from a GP, which hadn't really made any difference, so she didn't carry on with them. Through her university years, she was very much, she studied hard, but she also played hard. She burnt the candle at both ends. She had a part-time job. When she left university, she married her partner and started up her own business. So she's a lady who's very driven, quite obsessional about quality and detail. And to get the job done to the standards that she set herself, she will often work late into the night. And she uses caffeine and chocolate to fuel that. She has a couple of children who are in their teens. She uses a coil for contraception. Her periods are not as regular as they were, and they're less frequent and they're lighter. But along with this, she's got some hot flushes, night sweats, vaginal dryness, and loss of libido. So usual sort of perimenopausal symptoms. But on top of that, she's also noticed that she's increasingly fatigued, she's gaining weight, her hair and skin feel dry, and in between her hot flushes, she feels cold. So her thermostat's completely gone. Her sleep had already been poor, but now she's also waking in the night with night sweats. So this is exacerbating her fatigue. And she used to enjoy running, but now she's not really got the energy to do it. She has quite a lot of work-related stress, especially through the busy spring and summer event season. And she's finding it increasingly difficult to cope. If anything goes wrong, she becomes irritable and sometimes tearful. And she just feels like there isn't enough time in the day. She generally felt that her diet was healthy. A typical day would be breakfast was porridge with honey. Lunch might be pasta with a tomato-based sauce and cheese and a diet yogurt. Dinner, meat or fish with potato and vegetables, but usually also a dessert of some kind. Snacks in between would be cereal bars or chocolate. And drinks, she'd have water, sometimes flavoured. Coffee, likes it strong. Alcohol in the evening or weekends, wine or gin. So she lives with a supportive husband and her children, and she has some good friends that she regularly socialises with.
So we're just going to show you how we actually plot that history. We're going to show you a little bit about how we take that history and put it into a timeline. So as you can see, Ailsa, you want to just talk through why you've pulled all of this kind of stuff out, or how do you find when you are actually doing a timeline?
Yeah, so the bit above the dotted line at the top is where we put the birth history, that she's a full-term normal delivery and she's breastfed. So the significance of that is that it sets up your gut microbiome. So through a vaginal delivery, you pick up bacteria from your mother's birth canal, and also through breastfeeding, that's a way again to be inoculated with healthy bacteria. But those healthy bacteria will also depend on the health of your mother's microbiome. So the fact that her mother has a history of IBS would suggest that maybe her microbiome isn't particularly balanced. So she may already have started at a young age with some imbalance there.
So that's just from that little section at the top, we've already got a lot of information.
Yes, absolutely.
relating to this patient. And then, so we've kind of looked into there. So you've plotted in all the ear infections, the antibiotics, and then when she went to uni. And then at the bottom, we put in all the current symptoms. Now, we then use something called a matrix. I want to explain a little bit more about how the matrix helps us when we're with the patient.
We look at things called antecedents, which are really what has set us up for ill health or good health. So again, we've got the full-term normal vaginal delivery, breastfeeding, family history, then anything that we think may be a triggering event. So the antibiotics, stress, any traumas, major operations, there might be a toxic exposure, all sorts of things there. And then mediators and perpetrators are things that just increase your risk. And they're often chronic things in the background. So like chronic stress, chronic poor sleep, the fact that she's a perfectionist and that she spent time burning the candle at both ends. Then along the bottom, we look at the modifiable personal lifestyle factors. So these are really the foundations of good health. So how you sleep and relax, your exercise or movement, salient points from your nutrition history, how you deal with stress and what relationships that you have, who's in your corner supporting you. Then this area in the middle is really looking at the 7 different areas of function. So how assimilation is how you digest and absorb your food. Defense and repair is about the immune system. Energy is, like it says, it's how you produce your energy. Biotransformation and elimination is how you detoxify. Transport is the lymphatics and cardiovascular system. Communication is hormones, neurotransmitters, and so on. And structural integrity is really if you've got all your organs and bodily parts in working order or not. Then right in the center is the mental, emotional, spiritual factors, and because they also obviously influence the physical health.
This kind of looks at what that first diagram that we showed, all the things that affect health and all the symptoms that we're experiencing. So this is a way that all of the different factors that are affecting one person can be seen on one piece of paper. And I think that for a lot of patients to see us actually hear every single thing that is affecting them on a piece of paper. And then one of the things we do is then to sort of tell the story back to the patient, trying to make those connections. And like Ailsa started to talk about, like the normal vaginal delivery and the breastfeeding, and how that would have set her up already to have an imbalance of the gut microbiome. For me, that's how I kind of start my retelling of the story. And that often sparks off that, oh, that's how I've got to where I've got to. Because often hormonal imbalance doesn't drop out of the air. It's been going and coming along. And as we can see probably in this patient, would you say, how would you make your connections? I'm talking to all the doctors. How would you make your connections for this lady so that she can really understand how she's probably got to where she's got to?
Well, you can see from, she starts off with, so like Ailsa said, although she was a term delivery and breastfed, so she had a good start in terms of inoculation and her microbiome, she's already set up for possibly not as good a microbiome because of her mother's history from having IBS symptoms herself. And you can see that the triggers that affect the microbiome yet again in her lifetime was through the antibiotic use as a child and as a teenager.
So when we're talking about the microbiome, just so that people are aware, just in case you've not heard that terminology before, does anybody have a nice way of describing it that makes it sound very simple?
Well, we are actually living with billions of microorganisms on us and within us, and we need each other to survive. And our microbiome in the gut is key for our immune system to work properly, for our hormonal system to work properly. And when there's an imbalance in the microbiome, then that can trigger problems with the immune system and cause inflammation. And suddenly you can see from those triggers, she's then in her mid-20s starting to develop symptoms from that imbalance in her microbiome, with bowel symptoms, which is the irritable bowel symptoms of the constipation, bloating, loose stool, flatulence. And then she's developing intolerances to certain foods that she wasn't intolerant to before, such as the gluten in bread and that kind of thing. And the GP trying very hard there, as we would as GPs, to try mebeverine and colpramine, and that, you know, we're treating symptoms there, and it's not helping because we're not getting to the root cause of her problem in a conventional way.
What we're saying is that imbalance in the gut bacteria is being expressed as the symptoms, as IBS, constipation, diarrhea, bloating, flatulence.
Yeah. And what we try and do in conventional medicine is treat those symptoms, not understanding that root cause of the microbiome imbalance. So we're never really going to get on top of the symptom. And then those symptoms, the symptoms are the body telling you that it's out of balance.
Yeah.
And what do? We plaster over it with medication rather than saying and listening even further. Go on, tell me more.
Exactly. So like what I was saying in my little bit about stress, you can see from that part, she's having all the IBS, she's having the constipation, and then she has all the problems with leaving home and burning the candles at both ends, as Ailsa said, and then she has childbirth, and then all of those pressures. Then that seems to then be related to all the other symptoms that she's now experiencing, like the fatigue, the tiredness, the weight gain, and the night sweats.
And she set herself up really for problems going into the menopause now because of what's happened earlier in her life. So we can see that progression that, oh my goodness, I'm not surprised that you're really struggling at menopause. as your protective estrogen is naturally falling, I don't believe that women going through menopause should have to suffer symptoms of menopause. You know, if you look after yourself well and your body is in balance, it should be much more easier than having all these unfortunate symptoms.
Then looking at all of this, you then look at the modified lifestyle factors, because that's where, I think they call it the adrenal bank. Is that right, Ailsa? That's where you're going to get your healing from. It's your sleep, your relaxation, your exercise. And at the moment, her symptoms are affecting the sleep, the exercise, the nutrition, the stress, and that kind of thing. So we look at that, and that is how we then develop a functional medicine prescription. Would that be the right way to look at it? So what did you put in her prescription then, Ailsa?
So for the functional medicine prescription, we'll give some advice about how to improve sleep, maybe some suggestions about some exercise or movement that will suit where the person is at, some nutritional advice, and some tips for managing stress. And this will be dealt with in much more detail with their appointment with a health coach.
And also with our nutritional therapist as well. So when we first did this recording, we got our other health coach, Roz, to talk about something called the elimination food plan or the discovery food plan, because that's often the first step for a lot of our patients, is to have a kind of like a reset. Would that be the right way to look at it? Sort of a chance to just...
it's like a Control-Alt-Delete.
Yeah,
that's exactly the term I use.
So it's like a reset. It's not forever. It is, I think I like Shakila's way of putting it. It's a discovery. It's a chance to really kind of get to know your body and what it needs. So Roz was going to talk a little bit about how she as a health coach can support patients, because making these changes can be tricky, really. So so we'll probably do a little recording with Roz with her little tips about how to make food changes and how she supports patients with that. So with that, so they go away with this little report. They know about the food and everything. And the other thing that we put with this report is maybe some advice about testing. And that was one of the questions that we had at the last webinar, was the kind of testing that we do. So the testing that we have, sometimes people do it before coming to see us, but now we're trying to see the patient and make our assessment. Because like, I guess for this lady, we can tell that stress is going to be one of her root causes, would you say, ladies?
Absolutely.
Yeah. And so really helping her to support her stress and her sleep will already start to improve a number of different things.
Yeah, so while we're looking at tests and getting on with organising them and waiting for results, there's so much that can be done in that interim.
So what we do at our practice, Meeta's going to talk about our testing.
So for this lady, we would, for most of our patients, we would consider this blood testing, which is it's called functional DX, and it provides two reports, one a very extensive report for ourselves, and also top line findings for the patient. It has over 80 indices, which you wouldn't get in conventional blood testing. So it will go through 13 body systems. It will go through levels of oxidative stress and inflammation of the body, lipids, and lipids are very important for hormones, because as we've said, when we're looking at hormones, we need to look at are we able to produce them properly, and of course we need cholesterol to be able to produce our hormones. We also, in this report, are able to look at key nutrients, because if we don't have the appropriate nutrients, then how can we build our hormones? How can our hormones be sensitive enough when they get to the cell receptor to trigger whatever function is required from that hormone? And you won't find these kind of nutritional tests in conventional medicine, things like zinc, magnesium, selenium, that kind of thing. The other very important thing to note with this blood testing is that when we do the thyroid blood testing, we're not just doing TSH and T4. You'd be lucky to get T4 in most places conventionally. You usually only get TSH, which for us, from our perspective, TSH, it can be high, low, or normal, and still cause problems if it's normal. So in this blood test, we look at many different indices of thyroid health. So we would look at T3, we'd look at T4, we'd look at something called reverse T3, which is the body putting the brakes on your thyroid function. And we would also look at both antibodies if you have a possibility of autoimmune thyroid problems. And finally, with any of these blood indices, we are looking at optimum ranges. Now, in conventional medicine, as long as you're within a range, and the range is usually quite huge, then you will be told it's normal, go away, there's nothing wrong with you. But we are looking at optimal, so our range that we're looking at that you should be in is a lot narrower. So where we scrutinize it a lot more, we're much more sensitive to swings and shifts in the range of these results.
Just to say, Mita, before you carry on, that the FDX doesn't include the reverse T3 and the thyroid antibodies. They would be additional, added on to this performance report. So there are a number of different panels that we can do, but you can add on the other panels to it.
Okay, that's all I was going to say on the blood testing.
So within that as well, you do have your hormonal levels, like your estrogen, progesterone, testosterone levels. But another test that we do use for some of our patients is something called the Dutch test. So I really quite like the Dutch test. It gives us so much of information. And Mita produced this lovely, well, it's not produced, you took it off of the Dutch one. And you also really like reviewing the Dutch test, yeah.
It stands for dried urine test for comprehensive hormones. So yeah, the functional DX does do the hormones, your sex hormones, etc. But the Dutch test will check the cortisol pattern. It will look at your level of cortisol on awakening and what happens throughout the day, right to when you go to bed at night. Looks at melatonin levels, testosterone, progesterone levels, and the estrogen. You know, there's 3 estrogen hormones that we look at, but people don't realize that it's not just one. And you can see there we get a beautiful report on the Dutch test. We're also looking not just at the hormone levels, but what the body does with those hormones. So we're looking at how the body metabolizes the hormones, and the other hormones we also look at are the neurotransmitters, the adrenaline, noradrenaline, so your stress hormones as well, which is invaluable really.
So we can start to see the connection between all the hormones. So now that we've done this, we've done some testing. I'm just going to briefly show you the kind of nutritional plans that our nutritional therapist would be working with yourself. So we have like an elimination food plan, and when we get Ross to talk about this, one of the things that she does say on here is, even though it's called an elimination diet food plan, everything that you can see there, you can eat. So it's not about restricting the foods, it's about really finding foods that are really going to nourish you and support your gut and support your body to give you all the components that you need for your hormones to work effectively. So you can see there's a big list of things there that they're eating. And relating to the nutrition, we have a little video from our nutritional therapist about the effect of food on hormones.
Do you eat a lot of processed, fried and refined sugary foods and drinks? If yes, it is likely that your hormones that affect your blood sugar levels are out of balance. The peaks and troughs that you get after eating these foods and drinks can leave you feeling sluggish and fatigued. Diets high in sugar and refined carbs have been shown to drive insulin resistance. An imbalance of hormones can also lead to cravings, weight issues, low mood, brain fog, and poor sleep. Eating complex carbohydrates and whole grains such as brown rice, quinoa, lentils, and sweet potatoes are ideal, as these foods are rich in nutrients and release their sugars slowly into the bloodstream, making a positive effect on your overall health.
A lovely Shakira there. So, what do we have got? Let me just find that. So what we have is that we have got this patient, we fully understand her history, we know what her root causes are, we have an idea of the imbalances that are happening in her lifestyle. We've sent her off for some testing to look at the different areas of the hormones to really kind of back up what we thought of in her history. She would then see Shakila to start the process with her food, and then she would see one of our health coaches. So Fiona's going to tell us a little bit more about health coaching and how she would potentially support this lady.
Thank you, Indra. Everyone is unique, so that the coaching program is customized to suit your personal challenges. And the other thing is that we give sustained support throughout your health journey, so that to enable you to get from where you are now, currently, to where you want to be with your health. And we explore how lifestyle factors may be impacting your health or impacting your recovery from a health issue. And we identify internal strengths and resources to enable you to reach those goals. Now, as Indra said, here at the practice, by the time that you see a health coach, you'll have already had a clinical consultation with one of the doctors. You'll receive results from the recommended tests, and you may have been prescribed supplements to offset deficiencies or intolerances, and have started a particular food plan, which Shakila, our nutritional therapist, will have discussed with you to enable you to personalize it to your lifestyle. The first appointment with a health coach is really critical. It's all about getting to know you, ensuring that you are familiar with the doctor's recommendations and how you're getting on with the food plan, and identify any other concerns and discuss specific health goals. And then we work together to break those down into actionable steps and agree the best place to start. With Amanda, clearly from what we said before, stress is an issue for her that is definitely impacting her symptoms. And it's not a case of just saying, well, here's some stress relievers, you know, do you like meditation? Do you like going for a walk? It's very important that both in that first appointment and subsequent that Amanda identifies where her stress is coming from. And for many people, that's quite a light bulb moment, because yes, they feel stressed, but actually haven't thought about what is causing that stress. And by enabling them to identify that, we can then decide how best she can manage that stress. And also the other thing about stress is how that is impacting her sleep, and also her hot flushes at night, her night sweats, all coming back to how stressed she may be during the day. The other area which Shaquila will have overseen prior to that is her reliance on caffeine and chocolate. And as you saw from Indra's previous slide, you know, the high production of insulin, causing insulin resistance, having that craving for chocolate is only going to exacerbate that situation. And we can work with Shaquila's guidance to see how best we can cut out so much chocolate and so much her reliance on caffeine, and what else can we enable her to drink instead. And the other thing, when we've been able to deal with the stress and her nutrition, is at some stage, whenever she's ready, reintroducing that exercise that she used to enjoy, but at the moment feeling so fatigued that she can't even do it. And so by getting to know her in that first session, and in addition to the recommendations, she may have some other health goals that she wants to pursue first to enable her to feel so much better. And the other area that that we support Amanda with is making those changes, because we're all creatures of habit, and therefore change can be a big thing to maintain. But it's about taking small steps, and it's about taking one day at a time, one step at a time. And I'd like to give you a quick example of how small changes can have a huge impact on somebody's well-being. And it was a lady that I saw before I moved to Harrogate, and she was living with her husband, but finding mobility very difficult. She had severe arthritis, was on lots of medication. And when I first saw them, they were both at the stage of deciding that the only way forward was to both move into a home, neither of which they wanted to do. Neither of them wanted to do it. But unfortunately, husband over the years hadn't been able to cook. They were reliant on microwave meals and quite a bit of chocolate, actually. And they really weren't coping. Daughter, who lived 40 minutes away, felt a bit helpless about how best to help them. And when I talked to this couple, they talked about the lovely cooking that Mum used to do. And the other thing was that she showed me pictures. One of the things that they used to do a lot was dancing. And they showed me pictures at various dances. They'd met at a dance, and this was something really special to both of them. Anyway, as a result of a number of visits, the daughter was quite willing to do some batch cooking, to portion food for Mum and Dad. I taught the husband to be able to order fruit and veg from a local farm shop, and even to change what options they had week to week. And as a result of that, Mum was feeling Mum and Dad, but particularly Mum, was feeling so much better that she actually went back to her GP for a review of her medication. And as a result, some of her medication was reduced. As a result of that, she wasn't having so many falls. The husband was able to feel comfortable now about going out, because of course he wasn't ill, but he was having to stay at home with her and felt that he should be staying at home with her to look after her. So he was able to go out. So he went out for a coffee with one pal, and he went out for a beer and a lunch with another pal. And very unfortunately, I then moved back up to Harrogate, but I knew the neighbour, and I got a card months later in the post, and on it said, "You'll never guess what John and I are doing." And there was a picture of them both dancing on a cruise ship.
It's amazing.
And 2 years later, that couple is still living in their own home.
I just love that story, Fiona. Just shows what the small changes can make such a big difference.
Absolutely, absolutely. And the only other thing I'd like to add is that here at Dr. Indra's, it's very much a team approach. And you get that clinical input, nutritional input, and that expertise, and a health coach to support you every step of your health journey, not just to get better, but to enable you to thrive.
Thank you, Fiona. That's brilliant. Thank you. What we're going to do now is that there were a few questions that came up in the webinar. And if we haven't answered them, or if you've watched it and you were wondering, you know, please again do contact us and we can answer them. So one of the things that we wanted to talk about was the fact that we've talked about a female patient, and I know we've kind of put together a number of patients that we're working with, but we've all had cases of patients that are feeling a lot better with changes that we're making and small changes. But the other thing is just to mention is that we also would use the very same principles for male patients as well, in terms of dealing with thyroid abnormalities or stress or anything like that. We would also be able to support patients using, again, the principle that all hormones are interrelated, and we're wanting to figure that out. The other thing we also were going to talk about is thyroid and maybe HRT prescriptions. I guess one of the things that I want to make sure is that our patients have been through that matrix, we've started all the lifestyle, we've made sure that you've got everything you need, and at that point, if replacement is what your body needs, then that is something that we would be considering. So, Meeta, do you want to talk a little bit about replacement?
Yeah, so it's very common knowledge for patients who are going through menopause to ask about HRT, specifically estrogen therapy. But before we even go down the route of HRT, we need to really tackle the problems that are causing things like the hot flash. We get a lot of women that come and they want HRT because they've got hot flushing and all the symptoms that go with menopause, and to understand really that why does every woman at menopause will drop their estrogen, but not every woman has hot flashes. So what makes you different getting hot flushes? And some women are still having hot flushes at 65, and you haven't changed your estrogen levels for 15 years. So to really understand what's causing that, what's going on, and it's the adrenaline and the cortisol that's being produced because of the stress. It's the change in blood sugar, it's the insulin, it's all those things. And as soon as you drop your estrogen, which is a natural response at that time of your life, you notice these other imbalances elsewhere. And that's how the HRT works. The estrogen therapy works because it masks, it covers up those other imbalances. So that's why when you come off the HRT and you haven't cleaned up those other imbalances, the flashes will start off again. So we need to remember that before we even consider HRT. So, you know, like we've already said, we need to trigger the food and the drink and the drugs and check the thyroid, because if you're overthyroid or underthyroid can cause hot flashes, that kind of thing. And think about non-hormonal things first. So like we've talked about, the insomnia, stress reduction, exercise, avoiding sugar, caffeine, alcohol, doing specific breathing to help with temperature fluctuations in terms of nostril breathing or things like that to learn. And also, we can discuss things like botanicals for hot flushes. We know there's some good evidence for acupuncture as well, which really helps with menopausal symptoms. But at the end of the day, there isn't anything faster than an estrogen prescription. Okay, but like I said, we're treating symptoms, we're not getting to root cause doing that. And then nobody really ever mentions progesterone, and progesterone really is our friend. Progesterone will help improve your sleep, will help your flushes, will improve your cardiovascular system, improves your bone density, helps with bleeding issues, improves your anxiety, your PMS, your mood swings. And I'm not talking about the progesterones, the synthetic ones that you get from GP land, but the progestogens that are bioidentical, and we do deal with those kind of prescriptions as well. So yeah, before you go and get an estrogen prescription, there's so much to think about in terms of non-HRT hormonal balancing and HRT hormonal balancing.
Thank you, Meeta. That's exactly. But I think just from my understanding is I think we can get a non-synthetic progesterone on the NHS now.
But it's not really advertised.
No.
I don't think you'd get many GPs who.
Yeah, I've got one patient that is using it.
Well, that's good if it is.
So it is coming through with it. And the only other thing I really wanted to mention a little bit about thyroid. Ailsa, do you want to talk a little bit about some of the thyroid prescriptions that we do here?
Yeah, so quite often patients will come to us and they're on artificial levothyroxine from their GP. And so often they're saying, I'm on this and the GP says my TSH is fine, but I still don't feel right. I'm wondering about maybe trying some natural desiccated thyroid hormone. So again, what we would do is to go through the whole history, because there may be other dysfunctions elsewhere, maybe nutritional deficiencies that are preventing them from converting the T4 to T3, which is the more active of the two hormones. There may be problems with cell receptor sensitivity, or they may be pushing their T3 down the reverse T3 route, so that their body's basically putting the brakes on the system, making them feel very tired, so that they have to rest to let the body recover. So we would do a full functional assessment first before even considering prescribing natural desiccated thyroid. There are a number of preparations that are available. They're usually derived from pig thyroid. They are pharmaceutical grade, and there are direct conversions from comparable to the levothyroxine doses. They're usually a mixture of T4 and T3. So patients who convert to natural desiccated thyroid would need to have a repeat thyroid function test, similar to adjusting the levothyroxine dose, sort of 6 to 8 weeks after changing. And then once somebody's stable on a prescription, they might have a blood test every 3 months to start with, but maybe in the end every year, just once a year.
I think when we're thinking about prescribing things like the natural desiccated thyroid, conventional medicine has struggles with that, I think, with evidence regarding it, but so we would obviously just make sure that this is the right thing for you and this is the right way that you would want to approach your treatment. Is there anything else that we would like to talk about? Is there any other questions that I've forgotten?
No, don't think so.
Thank you very much, everybody, for listening to our little webinar. So always remember that your hormones are all interrelated. Your body is an amazing machine and it's always there to support you. And let's find the stress, because that often is when you can calm everything down. Thank you.
Thank you.
Thank you.
Thanks very much.